I rise very briefly, partly because I set, I believe, a hair running, which I perhaps need to explain, and also to ask the Noble Lord the Minister, who is replying to the debate, a few questions. I am told that I'm not whipped to vote for this amendment, even though the Liberal Democrat whip is to support the amendment, but those of us who have a conscience reason not to support the amendment don't have to do so. So I take that as being not a free vote, which is why I was of the view that, nevertheless, we were being whipped. Make of that, my lords, what you will. I shall be voting against the amendment. But, well, unless the Noble Lord the Minister can clarify certain points, because we've heard from the Noble Lady Baroness Sugg in introducing her amendment, and the Noble Lady Baroness Fox, that essentially this amendment changes nothing about the law on abortion. But we've also heard that if that were the case, we wouldn't need this amendment at all. If it changes nothing, why is this amendment here? So it must be changing something. And what I'm not at all clear about is what protections there actually are in place. Because the 1967 legislation was very tightly drawn. The nature of abortion in 2022 is much more widespread. The provisions are not perhaps quite as Lord Steele would have anticipated. But what we have here are it is a very detailed amendment. So we've heard it's very simple, but it's also very detailed. And it explains who women need to see. But they're supposed to be seeing people either via video or telephone. Well, my lords, I don't know if any of your lordships have experienced telemedicine during lockdown, but it's not always very effective. And if virtual medicine means a telephone call, not on a smartphone, your doctor cannot see you. They do not know how you're presenting. They do not know if you are vulnerable. They have no idea. So I think there is a real question about what certainty is there. Can the Noble Lord the Minister say what security there is about telemedicine? But also, we heard that women would still have to go through normal medical tests and so on. Where is this happening? Because in this amendment, all we hear about things are being virtual. So at what point do we know that a woman is 9 weeks and 6 days pregnant when she takes the first tablet? How do we know that she's not actually 22 weeks pregnant and, not seen by anybody? How do we know? What certainty is there? And if this is, for many people, a conscience vote, can noble lords think in good conscience? Do they believe that this telemedicine actually means that women are understood and their needs really recognised? Do they get the care that they would be getting if they were having consultations in a surgery?